So I guess, let me start with you, Director Alvarez. We have been trying very hard to get the hard data numbers from your group on how many businesses have signed up for the shop, maybe the state exchanges and the federal, and how many are in there. And we haven't been successful. Is that data available yet? Do you have those numbers? And if not, when might we see it?
So just to provide some context, in 2014, small businesses had the opportunity to apply for coverage through the SHOP program via paper application, utilizing an agent and broker, or directly through issuers. As a result of that, we are not the source of information as far as SHOP enrollment. CMS is not. We are working with issuers to get that information so that we can better understand the number of small businesses that enrolled in coverage through SHOP. And as soon as we get that information, we will share it with you, as well as with the American public.
Is the same true of the state exchanges? Were they all paper-based, or do we have data from is it 18 states that are providing their own? Do we have data from them?
It really does vary depending on the state. Some of them are working directly with issuers because they had a more manual process, while others are able to send numbers. As soon as we have a more accurate picture of what the enrollment in SHOP looked like, we'll definitely give you that information.
I mean, there's a sign in my office, people actually take pictures of it, and God we trust, all others bring data. It's the data that will tell the story. So to some extent now, we're all supposing, in doing that, there's always a bias. The data takes the bias out of it. So I would encourage, certainly as you now move into the electronic piece and you're going to be rolling out your, across, 5 states, kind of an early enrollment piece. My concern has been, and I own a number of small businesses, is I sometimes think of the shop exchange as a solution looking for a problem. Because the chambers of commerce across the United States did a marvelous job providing small businesses with health insurance, sole proprietorships and others. In fact, some would argue half the memberships at chambers of commerce signed up for the health insurance. And now that they're no longer in that, I just, Ms. Alvarez, what would you say to those like me who would say we had an opportunity through the chambers of commerce and whatever, it was working well, and now we're into the shop exchanges. Any comments there?
Definitely. And it's important to consider that when we speak to small business owners, when I've talked to folks across the country, they want to provide coverage to their employees. They want the opportunity to give this as a benefit. And what we know is that we want to provide that opportunity through the SHOP program. And when we talk about previous plans that were available to small businesses, we have to really talk about the quality of the coverage that small businesses had access to and the risky environment that they were operating in. If one person got sick, premiums would go up. Sometimes if they needed hospitalization or treatment, it wasn't covered because it wasn't part of the defined package of services. What the Affordable Care Act is doing is providing access to health insurance coverage that's high quality, that provides a package of essential health benefits that's going to be there when you need insurance the most. That's the reasoning behind ensuring that small businesses have access to these types of plans so that they know that their coverage will be there when they need it the most. Services like preventive care, hospitalizations, emergency room care, cancer treatment, services that we want and expect insurance to cover.
Sure. So what do you say to the patient who had a policy where their drug treatment for cancer was provided, and now they've signed on to an exchange and it's not covered anymore because they, in their formulary, took it out? Or how about the person who was going to this hospital and all of a sudden, under the restrictions of the insurance and the exchange, that hospital, they can't go there anymore, or their doctor's not in there? So I'm just curious, because I think you would agree there's cases where cancer coverage has been dropped from the formularies, hospitals have been dropped, and doctors have been dropped. Isn't that an accurate statement?
I don't know the specifics of what cases you're referring to, Chairman, but what I can tell you is that what the marketplace is intended to offer is options for people.
Intended?
So it does offer.
Okay, but you stated that they get all this coverage, and I'm saying that's just not so. I've had people call up and say, I had my cancer drugs covered, but now under Obamacare, they have to provide prescription drugs, but subject to their formulary. Am I wrong? I mean, does Obamacare require that every drug be covered under all the formularies?
Not every drug.
Right, so they dropped the most expensive ones. Does Obamacare require that people can go to any hospital?
No, the networks vary.
Yeah, to sometimes so restrictive. How about if you had your doctor, you can keep it? Are all doctors in these plans?
The networks vary.
Yeah, in other words, it's in many cases a very bad day at the office when somebody comes home and says to their spouse, we lost our hospital, we lost our doctor, and by the way, I just lost my cancer coverage. So I think it's, again, the facts mean a lot, and I know you're sugarcoating it, but these have been very painful times for a lot of folks. As was pointed out, small businesses that had insurance, and you are right in saying in many cases without prescription drug coverage. What I've seen is prior to Obamacare, a lot of small companies with younger employees were able to provide that affordable health care, and they did not offer prescription drug coverage. But in the younger populations, if most of your employees are under age 40, to a large extent, that insurance was very affordable. Now, all of a sudden, they have to provide prescription drug coverage, so they lost all their insurance. So I would beg to differ when you again, put this happy face on it. If I'm 35 years old with a young family and I have health insurance, and now because the new policy I have to have has prescription drug coverage, which my family doesn't need, because antibiotics are generic. A lot of pharmacies give them away for free. Most high blood pressure is generic now. Lipitor equivalents are generic now. That was not a good day for folks to come home and say, I now have no insurance.